continue with our next speaker, who will talk about continued privatization and other aspects, including healthcare. And this will be by Donald Cohen, who is the founder and executive director of In the Public Interest, the National Resource and Policy Center on Privatization and Responsible Contracting. He is most recently the co-author of the book, The Privatization of Everything, which I would really strongly encourage everyone to read. Donald was a founding board member of the Partnership for Working Families, which was recently named Power Switch Action, and he is the former political director of the San Diego Imperial County's Labor Council and founder and executive director on policy initiatives, a San Diego-based think tank and policy organization. He's currently on the board of the Ballot Initiative Strategy Center, and his opinion pieces and articles have appeared in the New York Times, Reuters, the LA Times, the San Diego Union Tribune, and the New York Daily News, and other online and print outlets. So, I now welcome to the podium Donald Cohen.
We have to shorten that. I don't know whose computer says I'm closing it, so I don't know what's going to happen. That's what's going to happen. So I want to thank you, PNP, for inviting me. I just want to, I haven't been in a room like this for almost 30 years, and I'll tell you why. Anybody from California? So in 1994, a very small group of us put a single payer that collected 1 million signatures and put it on the ballot, a single payer ballot measure to create a single payer system for California. That was in 1994. So it was quite an effort, and bad news is we got crushed. I just want and I still have scars. But it's kind of cool. I haven't listened to conversations about upcoding and all this stuff in a very long time, so I really appreciate this. I took one lesson out of it was Proposition 186, and that is that if we don't rebuild trust in government, we're sort of out of luck in terms of all the things we want to do. Getting everybody health care, cleaning the environment, all the above. And somehow, that was 94, still not going too well. I'm not going to talk very much about healthcare, actually, and Medicare. You all know that. I'm going to connect, my book connects the dots, and it covers sort of all sorts of public goods and services. So I'm going to give you ideas and big picture stuff and examples that you'll be able to, and we can do it in the questions, connect to everything that I heard just this morning. Let me start by giving you my definition of privatization. I define it as private control over public goods. I made it up. That's my definition. But then, how do I define public goods? Again, this is my definition. I think there's 3 things. It's the things that we all need to survive and thrive and get through life. Obviously, healthcare and education and the ability to move around, transportation and a clean environment and healthy water and all of the above. That's number 1. The second is that these are all the things that we need everyone to have. It's in all of, I'm going to tell you, it's in all of our interests for everyone to have health care, or it's in all of our interests for every kid to be educated, even if you don't have kids. And the third is that these are things that we can only do if we do them together, right? Through government and public programs. Now, the economics textbooks, if there's any economists in the room, have a different definition. They talk about it very differently, and essentially, without getting into the details, say that it's sort of the market can take care of most of that. I disagree. I think those are things that we should be able to decide democratically, right? We should be able to decide that everyone gets health care. Right now, it's pretty clear that broadband access to the internet is a public good. Everyone needs to have it, period. And we should be able to decide that. And go to college and have childcare and kind of all the above. So I'll talk about privatization. What's preventing us from having these things? First off, it's real clear. It's about power. That should be very clear, I think. Again, you all know this. Like I said, privatization is private power and control over public goods, and that's exercised in a few ways. First, contracts and agreements. Just, privatizing a prison or a road or selling off a water system. And that gives, control over, I'll give you examples. That gives control over lots of stuff. Second is policy action, right? And, if you cut taxes and you don't have money to provide health or to provide childcare for every family that needs it, then we are left in the market to, to fend for ourselves. We would call that austerity. We're not funding public services. I believe childcare is pretty much a fully privatized public good in America. Healthcare remains, as we all know. And the other way, the third way that I think private entities get control is through under-regulation or deregulation or lack of enforcement of regulation. And the example I use, if there's a polluter next to a school, to be very practical, that is, not monitored, not enforced, not control their emissions and stuff, then that company has some level of control over the lives of those kids in that school, right? And you can take that to anything, food safety and all of the above. So, and then of course, our political control, which I was sort of looking forward to coming here this weekend, but I'm already depressed from the previous conversation. I'm not going to be very helpful. And I'm looking forward to a bad week. I'm very depressing. So those things, that power and where we are, this is a big picture, so I hope you'll stay with me, did not come out of nowhere. This is not an accident. Someone mentioned you've been doing this for 40, 50 years. So I take two forces that are driving the push to privatization. Someone said neoliberalism, sort of the markets can do everything. One is the true believers. Milton Friedman said, this is the quote, he said this in 2004, not in 1955. He said, "In my ideal world, government would not be responsible for providing education any more than it is for providing food and clothing." These are true believers. I have a cousin, some of you may know Charlie Sykes. He's on TV, he's a never Trumper, we lost touch, we're back in touch. He's a true conservative. He believes the markets, that's the way to go. He hates Trump. So that's force number one. These are true believers that have, that are ideologues. Then the second is massive corporations, which is nothing new to draw. There's trillions of dollars at stake, and they want a piece of it. Right? We're talking about and trillions at state, local, and federal levels everywhere. And I could go through industries. There's 3/4 of a trillion spent in education. They're hovering at tech firms. Prisons, there's 100 billion with prison corporations looking at it. So it's really clear. It's about the money. So these forces have had some real success over the last 50 years. I think we agree in changing our sort of basic beliefs, our politics, and our government in very real ways. In my work, the organization I'm on, we work with groups around the country, fighting a water deal or private vouchers or all kinds of stuff. And we hear the same arguments all the time. I wanted to say this at the beginning because it probably will resonate. Several arguments we hear. Market competition and the profit motive are a more effective way to meet people's needs because people can vote. Choice gives people an opportunity to vote with their dollars. It's actually more democratic if you turn everybody into a consumer. Second, businesses are just inherently more efficient. And government is inherently inefficient. We hear this all the time. Third, we should run government like a business, sort of like the market do it. And then finally, we don't have the money to do the things we want to do, to build the roads, to put lead, to get lead out of the water systems, all that. So and we need the private sector. So now I'm going to go through sort of my core ideas why all those things are wrong. So first idea, privatization. It took me a while to realize this. And this is the core of the book. Privatization is an assault on democracy. I'm going to give examples for each of these ideas. Give me a 10-minute also, because I have no idea what time it is. So, Chicago. Anybody from Chicago? Yes, I talked to you. Okay, in 2008, you all may remember, the city was bleeding red ink, Great Recession, all cities were having trouble. On a Friday, the mayor announced a proposal from 3 global corporations, Morgan Stanley, what's called a sovereign wealth fund from a Middle Eastern country, and LAZ Parking. I think they have some here as well. That they would give the city $1.1 billion up front in exchange for control of the city's 36,000 parking meters for 75 years. Do the math, 2083. I know I'm not going to be driving that. So, vote on Tuesday. Now, everybody now, you all in Chicago, does this sound familiar?
Yeah.
Okay, rates went way up. It was, everyone hates this deal. Terrible deal, stupid, horrible way to borrow money on your future revenues. Okay, everybody borrows money on the future, but horrible. But here's the problem. Here's the real problem. For the entire life of the contract, up until 2083, if the city wanted to eliminate parking spots temporarily for a street fair, or more importantly, permanently for dedicated bus lanes to get people out of their cars, or bike lanes, or pedestrian malls, because we changed land use patterns and want to deal with climate, the city has to buy them back. Okay, so you're the mayor and all the people, city council members of the city of Chicago, your hands are tied. And I worked with a professor at Roosevelt University who interviewed transit planners, this was a number of years ago now, for the city, who weren't able to implement a plan to create dedicated bus lanes, bus rapid transit, because they just didn't have the cash. So that's what I say, this is a straitjacket. These are handcuffs on democracy. They can't do their job because they are contractually obligated to the pilots. Another quick example, universities. A number of universities are now privatizing dorms through public-private partnerships. There's a company called Corvias. And, pandemic happens, kids are sent home, many of you are students here. When some of the universities wanted to start bringing back students, but wanted social distancing, so lower occupancy, they got a letter from the lawyers, the company lawyers, that said the following: the university does not have the unilateral right under the agreement to institute a policy that would, for example, limit the number of students who can occupy student housing, or reduce housing fees for which the concessionaire has a contractual right to receive. The head of the university, you want to educate students and keep them healthy, you're contractually bound from doing what you think you should do at that time. Second idea, markets. Markets are simply the wrong tool. We all use markets, we all buy stuff for public goods. Example, the weather. We all use our weather apps on our phone, right? And look at the weather on the internet, on TV, or on phones. All of the data is public data, captured by the national. That's 10 minutes. Okay, I'm gonna speed it up. All the weather is created by the National Weather Service. It's given to companies to package up and provide extra services to companies. What's her name? AccuWeather, one of the biggest ones. They have one of their clients was Union Pacific, cargo rail company. In 2015, there was a tornado in Oklahoma. And so the president or the CEO was sort of touting their services after the tornado on some TV show. And he said the following: 2 trains stopped 2 miles apart. They watched the tornado go between them. Good thing, right? He goes on. Unfortunately, it went into a town that didn't have our service and a couple of dozen people were killed. But the railroad did not lose anything. That's what happens when you put things in the market. Some get, some don't if you have the money. I'm going to talk just a little bit, I'll try to be fast because it's important. We do a lot of work on public education. There is a wholesale assault on public education. Vouchers and the growth of charter schools. There's good charters and bad charters. It's growth. Charter schools compete. Someone talked about the impacts of the downside of competition. Compete with public schools and others for the kids and the money that comes with them. But so here's some of the downsides of competition. Charter schools, while it's illegal, will figure out how to screen out and sometimes counsel out or push out the kids that are harder to educate, that are more costly to educate, kids with special needs, behavior problems. Because in the school choice marketplace, when parents are choosing a school, they're looking at test scores. And those things will bring down their test scores, and so, you're right, they're figuring out how to manipulate the market and the metrics to do well and to get more money. There are charters that require their teachers to sign NDAs as a condition of employment, non-disclosure agreements, that they will not share the school's trade secrets. What are the trade secrets? Curriculum, lesson plan. Here's a quote from one of our high schools, I think it's funny. all know-how and show-how, whether or not protected by patent, copyright, or trade secret law. Know-how and show-how of teaching kids. And we pay for it. And the original idea of charters was to create laboratories of innovation, come up with new ideas, and share. Finally, or next, I want to do two more things. There's a difference between public and private. It's really important. I heard a lot about this morning. Really, I say this everywhere. Businesses do one thing. They sell stuff. That's it. That's all they do, right? Insurers sell coding. I mean, whoever does the upcoding, they sell codes. Prisons sell beds. For-profit colleges sell butts and seats. I mean, it's just, that's, iPhone companies sell iPhones. So what do they pay attention to? How many they sell, what it costs to make, what their delta is, what their profit is, and what their market share is. That's what they pay attention to. It's not good, it's not bad, it just is. So the problem is they want things that we don't want, right? And so we just have to be very clear that it's not, I have to go into lots of different kinds of rooms. We're not against business. It's just it's just the wrong thing. They have different purpose. We have different purpose from public purpose to private purpose. I want to talk about efficiency for a second, because we always hear, oh, the private sector is more efficient. They say, I know we get it every day, every place we go. They're going to save money, right? So Iowa privatized their Medicaid. Anybody from Iowa? Listen, Iowans. And of course said there'd be lots of savings and all that. So let's just do a little bit of math. And they gave it to 3 companies, United Health and one other, and I can't remember. So the CEOs of Anthem, the parent group of Amerigroup, which got some of them, their top 5 executives between 2018 and 2020 made $108 million. Okay, so there's that money leaving. There's dividends to shareholders leaving. There's political money that they spend leaving. Then there's debt service, because they're buying up and doing mergers and acquisitions. That money's leaving the service. So when they say they're going to be more efficient and they're going to save money, they got to get it from, there's not many places to get it from. Care, right? It's pretty obvious. So we deal with this a lot. So I have one tool that I use to teach policymakers. When they say they're going to be more efficient, because efficiency, it could be more efficient. Do less, put less effort in, get more out, spend less money, get more out. It's a legitimate thing. We say, if they're going to be more efficient, we want you to tell us exactly what they're going to spend less money on, because it may not be in our interest. Efficiency is not a good in itself. Finally, it's just a question of how we pay for things. Things aren't free. Water's not free, healthcare's not free, and how we pay matters. But the only question is how because we don't have the money, right? So public-private partnerships, a new water system. I was just in Jackson, Mississippi. We don't have the money to fix it, so we'll bring in the private sector, right? And then the magic words to elected officials is no new taxes, right? So borrowing the money for a big capital investment like that is the easy part. It turns out you have to pay it back. And so there's only one place to get money to do the things we want to do, to build infrastructure, to provide healthcare, and that's us. Taxes, tolls, and fees. That's it. There's no magic money. So you're going to reduce taxes, but what happens, of course, if it's a water system, then the rates go up. Because things cost money. And you have to, I've done that little thing for journalists for the last 4 or 5 years. You have to start with the basics. Things cost money. Flint settled, I don't remember who the plaintiffs were, settled for the state of Michigan $600 million lawsuit for what had happened in Flint. They got to borrow that money from the bond market, so that's just an aside. Imagine if they had spent that money before. It would have saved lives, people would have had clean water, all that. So the only question on pay is who pays, how much people pay, and when you pay. Right? So I think that's sort of super important. How many minutes I got? Am I done? Because the next part is what do we do about it? I have 2 minutes, because I figure that's not the question, because that lady who says, what the hell are we going to do about it? It's going to get out first. So, there's 2 levels. We have to engage in a battle of ideas. The impact there, the right wing conservatives have had real impact. People don't like government. It's really true. we put it on the ballot in '94. They didn't like. They said, and then Congress takes over America. They said, get the government on my Medicare. You remember that? So they really don't. So they've focused on turning people's attitudes away from government and weakening the institution. And often what I will say is that we have often helped progressives, union members, all that. We have been failing. I've been doing this for a long time. We have been failing to lift up the good stuff too often. And think about it. Because we're advocates, we want to hold government agencies accountable, whether it's CMS or OSHA or whatever. Here's the bad stuff. We're focused on making things better, so we're talking about what's not working, or the revolving door. There's all sorts of things to talk about, right? It's not working out well. So the right wing is jamming on government. We're helping. What do we expect to happen? If people don't believe that we can do that, we need to first that there are only things we can do if we do them together, and that government is the institution that we can do it through. We have to make it good. We have to make it worthy of our trust. If we're not doing that, it's not going to happen automatically. It's not going to happen if we're not sort of a force for the public good and a force for the common good and for public services. Then at the local, because I'm pretty much out of time, I think, then that's the idea war. And then, of course, knocking down those ideas of efficiency in the market, sort of the core pillars of neoliberal market ideas. And then when you get to the ground, and we can do this in questions and answers, we have sort of tools to help folks understand how you intervene in proposals to privatize things. Let me just see if, last thing I'll say, people are doing it. There's lots of water systems around the country that are being insourced. There's school buses there's sort of insourcing happening a lot. Where it was out, was someone privatized and bring back in. That's happening. Transportation. There are some cities now that are providing free bus service. Kansas City, because you don't pay a fare to go to the grocery store if you're driving. Why should you pay a fare to get on the bus? You can socialize that cost, right? To make it. That's happening. And so there's lots of examples. They're all, some of them small, some are big around the country where people are doing this stuff. So the book's 300 pages, sorry, I just have to get through a lot of it. so I think, let's get to questions.
All right, yeah. All right, so we have about 15, almost 20 minutes for questions. I'm going to prioritize people that haven't spoken before, so if you haven't, I will come find you.
Well, we've heard a lot about profits, we've heard a lot about markets. I haven't heard the word capitalism yet this morning. Is that important, and is it consistent with democracy?
Of course it's important. So we're a think tank. I'll just say candidly, we talk to lots of different kinds of people. So I try to focus on the problems of capitalism, which is the sort of the details of what you talk about, of course. And then there's a question of what kind, right? Do we have Swedish social democracy, or do we have X, or do we have Y? But yeah, I mean, the success of the right over the last years is that markets are the primary tool for things, right? Which of course is capitalism on steroids. We have to push back on it. Well, I'm going to just leave it at that. If anybody's taping this, I'm an American.
I think your conceptualization of privatization has been very helpful. I want to make a comment about taxes and paying for things. Healthcare is really remarkable in that it's one of the few win-win situations in economics where we can actually get more and pay less. And everybody in this room understands that. And so I want to call attention to the online calculator that a team in California has developed, because this is a very useful handheld tool to demonstrate to people at a farmer's market or in the street or in a meeting exactly what that means for them as individuals. And so I encourage everybody to look at the handout. But remember, this is a win-win situation as far as payment. And so the privatization of healthcare can't use the argument that they can do it more efficiently. So they have to use other arguments, and we have to pay attention to that.
Yeah, and the goal of when I talk about public good, again, I'm not an economist, really, I say health is the public good, right? And so you spend money early, you prevent, people, I can tell you all this, absolutely. Right?
Alright, I'm going to encourage some of our medical students to raise their hands so I can talk to them.
One of the questions about financialization is.
Can you stand up?
Sorry. One of the questions about financialization is what happened since Ronald Reagan, where money moved up. Now there's clouds of infinite money looking across the waters of the earth, looking where it can extract more wealth. What, on your timeline, I'm assuming it's in your book, what happened since 1980?
Financialization, privatization, it's all right for cash, so yeah. So many people think that Reagan was the big privatizer, he wasn't. So he actually tried, he was the spokesperson for, markets and all that stuff, and anti-government, what did he say? 10 scary words, or government, I'm here to help. But he failed primarily because of, Tip O'Neill was head of Congress, and Jimmy was head of the House, and there was, and people still wanted the stuff. The New Deal ethic still kind of, the resident of the New Deal ethic was still around. So he failed. What happened in that period was actually quite, I don't remember if this is a book or not, but right interesting is the conservative ideologues, folks from Heritage and Cato and all these places, realized that they could use privatization as a wedge to turn people away from government spending, because they would, there's some quotes, I think they are in the book, to do two things. Turn people's demand for the stuff, the services, people want the stuff, to the private sector, right? So let's just change that. And two is organize the private sector to be a force for privatization, and they created, some associations of big corporations. Clinton was the big private, he implemented big time. Welfare reform, I think that was 96. The first major social service privatization, obviously outside of healthcare, as part of TANF, as part of that law. He created, Vice President Gore, it was the Improving Reinventing Government Commission, performance review. Privatization is baked in. And what was baked in at that period, in the language of this thing, there's two books, I've read them both. We are consumers of public services. I think that's really damaging, right? That's sort of at the institutionalization of the idea about markets. We're consumers, which means when you're a consumer, you care about the thing you're consuming. When you're citizens, you care about that thing, but you care about your role in your relationship and your right and obligations to others as well. So Clinton was the big one, actually. But, W tried to do Social Security, he failed, so, we still got something to work with.
One over here.
Hello, my name is Philip Letter. I'm a doctor here in Boston, about 3 miles from here in Dorchester, which is primarily African-American, Latinx patient population, really struggling community health center, many problems. And I just want to ask about privatization and how we can organize, following up on the other questions. How can we broaden this conversation to get more people hearing this message about single payer?
How can we organize? So, I think I've been an organizer a long time, and work with all kinds of groups and obviously all different issues, and so I think part of our problem is that we're in different buckets. We're all in silos is the word, right? And someone mentioned earlier, how do we bring the other movements into the single payer movement, right? Everybody's focused on their thing, right? But number one. Number two is the right wing is focused real clearly, lower taxes, fewer regulations, control government, just bust unions, stuff like that. We have to tie those things together, right? To say, no, it's not just we want this, we want, not like the laundry list of stuff we want, but we want, there's good stuff, lots of stuff to do. We have to tie those things together so that as we do our campaigns on the specific issues, better healthcare and community or what have you, it's advancing a new set of ideas of how the country should be run, and governing philosophy. I think that's really important because there's a lot of organizations. I mean, and then, you know, we can talk for this for hours, there's no substitute for organizing, it's actually talking to people and recruiting them, which is, I mean, pretty impressed, we got a lot of folks here, but I'm happy to talk more later.
I am Magda Rock, I'm an undergraduate in Dallas, Texas. And one thing that Dr. Gaffney mentioned earlier was with the Supreme Court decisions, like the EPA overturning Roe v. Wade, how are we going to build back trust in government and democracy when we have, you know, these forces like the Supreme Court making these decisions that directly affect health?
Great, impressive question. So here's what I said about in '94. You know, after we did that, I felt that our central task was to rebuild trust in government. I kind of actually a number of years ago decided that's not the central task. So I kind of lied a little bit here. The central task is to rebuild commitment to the idea of public. That there are things that we have to do together, and government is the institution. Yeah, listen, government in America, if you add them all up, is the most complicated human institution in civilized history, right? It's complicated. If we were, you know, the government entirely, we would mess it up, right? It's complicated. So our task is to rebuild commitment to the idea, because that's the other side says free market, and we don't talk, and then corporations are the institution, and then, bottom line, take over the institution so you can actually make it. I don't know if you all know this, but there's an election on Tuesday. I mean, you know, if we don't have the, when I started, it's about power. If we don't have the power to do the things, then, you know, all the ideas in the world don't matter.
Well, Philip Joya from Auburn, New York, and I wonder if it helps if you talk about externalities and the commons paradigm for talking to people that are economically conservative or people that just aren't thinking about the problems with natural resources, including health.
Yeah, I took the externalities out of the talk, actually. I talk about that a lot because it's just, obviously I had too much to say. I think, you know, that's also the problem with markets only that don't, you know, we have to force their externalities back into the business, right? The bottom line is, who's responsible, right? I mean, I'm not going to give you a great answer right now because I'm thinking about this, but if you're a polluter, don't put that price on us. Don't put that impact, rather, on us. If you are paying poverty wages, don't put that impact on us. That's the first thing, in terms of the idea frame, absolutely critical. Because, you know, because in fact, we allow the unfettered capitalism or unfettered market, right? Markets have, you know, less regulations, basically means they are shifting the burden and the cost onto us for public goods. I think it's absolutely crucial point.
Hello, yes, thank you so much for being here. I had a question. I'm a medical student, and I just want to acknowledge, like, all of us in this room right now are like highly educated individuals, right? But there are many people, especially in our current education system, in the public education system, that is underfunded and purposely being pushed in a direction of kind of, I would argue, like a brainwashing technique to get people to not think critically about things, and then when they are thinking critically about things, they think about them through a right-wing lens, especially in many of the states that are doing a lot of the educational work, especially by Betsy DeVos, who's education secretary, and then now by a lot of the state legislators, is quite frankly leading to undereducation, a purposeful undereducation of the masses. And so how does like the educational lack of educational like epidemic that we're facing kind of tie into this privatization, and how do we start to have communications with individuals that we are struggling to find common ground with because quite frankly they don't have the skills, or they were not given the skills to analyze these very complex topics.
Such deep questions. I mean, I've known politics a long time. I used to run campaigns. I don't understand America anymore. This is nuts. And we do a lot on public education with all this CRT stuff and all these, you know, these attacks. So I'd say, all these questions we could talk about, all of us, for hours. So my quick response is a few. One is that the question is, what can we do? And I don't think it's just improving the education system, especially when they're banning books. I mean, let's stop that first, right? We got to fight now, right? But people have grievances, right? And so what did Donald Trump do, right? He organized people, he was a spokesperson for people, what they were pissed off about or frustrated about or not having to pay their bills. And that's kind of a lot of the big political battle that exists. Who's got the answer, right? Who can articulate the problem in ways that, Bill Clinton was actually pretty good at that, right, in terms of a president. Who can articulate that, and then how can we point to a different answer? I mean, I guess, so obviously no simple answer. The one thing I would say is we have to remember it's a long game. Not a long game where you have to act every day, but we're not going to do this next year. We're not going to do, we're not going to change people's attitudes about markets and government next year. But if we're not heading in that direction, we'll never get there.
All right, I'm going to use the privilege of my microphone to ask a question, and then I'm going to take one more. I saw a hand over right there. So, as you probably heard this morning, PNHP has pioneered a campaign against direct contracting and the takeover of traditional Medicare. That's a campaign that we built, and I'm wondering if you have any lessons from your work that we should consider as we continue to fight back against that program.
I do know about direct contracting, and I do know about advantage. I became eligible last year for Medicare. I'm a member of Kaiser. I just decided to keep it. I'm not sure this will be smart, but I always come back to the math, right? Things cost money. Who's getting the money? How much are we extracting, right? For those, if you're something for profit, there's money going out of the system, right? How do we tell people how much money is going out of the system? How do we tell people about efficiency? Which is all exactly the issues you're talking about. The road to single payer is a long one. So I guess the other question, which I don't understand, is what are the steps towards that? I mean, I think, to be clear, we have to defend what we got, right? Suzanne, who asked the question before, is going to talk about VA privatization in one of her workshops. You should go, because we've been helping a little bit with that. You don't let it go further, right, as much as possible. And so, happy to have more discussion about that, because it's crucial.
All right, we've got one last question, and then we're going to move on to our next speaker.
Hi, my name is Yosha. I'm from Austin, Texas. I'm a third-year medical student. I just want to say thank you for the wealth of information that you shared, and everyone's really awesome questions as well. Something that I was kind of thinking about towards the end of what you were talking about, even kind of during the question period, was about how often I feel I've heard the idea of like the mechanism or the methodology of change would be to become part of institutions and change from within. I agree with your comments about how single payer is a long game. None of us, I think, are here because we're thinking, oh, tomorrow, we're going to enact that. And I also agree with your point about how we have to preserve what we have. I guess my question is kind of coming from an idea of how, LBJ was the one to sign in the Civil Rights Act, but it wasn't because of, LBJ's good heart. It was because of the mass mobilization of people who pestered and pestered and pestered. And I'm curious, do you think that we have the capacity to mobilize like that? There's a huge group of people here who are all interested in, or at least amenable to hearing about these kinds of things. I'm curious what organization strategy, I guess that can already happen from someone else, but I'm just curious, what are the methodologies for mobilizing and organizing that you think are potential to happen in the future?
So, boy, guess I should have expected this. So, first is talk to people and recruit. I think part of the reason we ended up with Donald Trump is that we weren't talking to people. In flyover states and red states, you've got to talk to people in large numbers. That's number one. Number two is, again off the top of my head, I can't give the example, but one thing at a time is a technical strategy that I use. One problem at a time till everybody raises, right? Whether it's the extraction, whether it's the upcoding, whether it's this. So what's our task? Create the public problem, which means bring focus to it, like a particular specific problem, and then have the solution, of course. So one thing to think about is one problem at a time where you really think and try to fix it. That puts you on a path to rationalizing the system towards single payer. So that's a, to the part about the inside, yeah, we've got to do both. We've got to get the inside as well. Because I don't know anybody at CMS, but I believe that in government, we work with local governments and stuff, is these ideas about the market and, are deep in fact, they're deep in the belief system. This is just how the world is. And we've got to knock those down for the bureaucracy, right? For people, as we go in, as we get people to go into the bureaucracy, there's another way to go. Anyhow, all of the answers to these questions are completely insufficient because they're huge. So I appreciate them, but I'm going to stick around, so I'm happy to talk more. Take it away.